Olivia. I'm the ostomy nurse here at Memorial. I just wanted to show you guys some of the new resources that we have out there, because in actual fact we have 2 new products. But before I show you the 2 new products, I just want to show you some of the resources that you may have seen in your supply room. Alright, you might have seen the green, red and blue thing going down, and you've thought to yourself, I don't know what that is, you know, what's happening here. Okay, there are reasons to the madness, but for your own knowledge, the most common one that is used at Memorial Hospital is called a 2 1/4, and that's the size of the actual flange. Most patients use this, and it goes with the 2-piece of a 2 1/4. Okay, that is for the most average stoma size. And then just for your own knowledge, each sizing, it's sort of the equivalent of small, medium and large. Each sizing or each colour has what's called a convexity, so it's not actually flat. Like there's a flat and then a convex one, so you can sort of see it bent in. But again, you sort of need to know why you're using all of that before you go there. And normally, maybe you would have a chat to me or someone that's used to ostomy a little bit more before you delved into these other products. But they are available to you. The other piece of knowledge is to know that people do go home with something that looks a little bit different. Their supplies that they get at home will have a gas valve on it, and also a little Velcro system that sits at the bottom. So they don't actually use a clip when they go home. Is that UTB? Mm-hmm. All right. And we also have the 1-piece available to us, and that is common too. Some people really love using it.
Just stop it for a minute?
It's really good with a landscape around the stoma that might be a little bit inverted, so a lot of people don't like to use that. The other resource we have, voila, is an information booklet. And you'll see the top corner, it says either ileostomy, colostomy or urostomy, and this is just a wealth of information for the patient. I'll just have it here. Just some of the things in here, girls, because you know going through something like this can be quite traumatic. Just imagine your own elimination system completely changed. Now you have poop coming somewhere else. All right. Just a couple of highlights in here is our stealth belt. There's actually 2 websites here. If you look into the package, there's a discount code as well for Ostomy Secrets. But then it also has a picture guide, also some emergency information. That's great to point out, because you may or may not know, if you're new to having an ostomy, it is a fecal ostomy. It's not good to eat hard things like corn, beans, hard corners of pizza and things like that, because you are at high risk of blockage. But anyway, this is the information in here. Also good to know, you don't have to drag the video everywhere, okay? You can actually get their own appliance, hand appliance, what do you call it? Phone, right? Or the cow, right? You know the cow, go into the internet, and if you go to hollister.com, Bob, you will find the Learning Resource Centre in there, and it actually has all the same information that you would show them on the video. And what I like about that too is they can go home and they know they can access it from home, and it's not just something we do here.
Olivia, do these people go home automatically with home care? That they'll help them with their ostomy?
Do you know what? That's a great question, TB. Unfortunately, not everyone goes home with home care. And it really takes a careful eye for the nurse, and obviously insurance plays into it to see if the patient does need home care. And in a lot of situations, the patient does need home care. And if not, we have to look at, identify a support person that we can really educate and make sure that they have that when they go home. Because we have unfortunately had situations when people have gone home and it's become a bit of a disaster for them.
So Olivia, how often should we be changing these ostomy pouches when they're here in the hospital?
So a good thing is probably, generally they'll get into a routine of twice a week, but when it would depend on if you're having leakage issues and things like that. Often when they come, when they've just had it, is the time when they're going to experience the challenges and getting a good fit with an appliance. So normally If everything's going well, it should be changed every 4th day. So I normally do it maybe, I say to the patient, a Tuesday and a Saturday might be their normal when they go home to change it. But obviously if it's leaking, you would change it again. And I mean, I have changed an appliance 3 or 4 times a day, unfortunately, when something more serious is going on. So, and the last thing, just to remind you with the home resource, with the resource they take home, these can actually be taken off the front by the nurse and placed into the patient's chart. It just gives you a guide each day of what's expected when it comes to ostomy care, because a lot of us, lack the confidence or we've not had the experience with it. And this is just some expectations of different things. And if you don't know, you can always chat to Tara Beth or some of the other girls on the floor or myself, and we can show you some of that education. Still got one there, Bobby Brown.
Keep going.
Yep. Okay, this form is an excellent form. Just make sure that your social worker is aware of it. You can even sign it off yourself and fax it off yourself if it's a weekend if you had to. But the great thing about Secure Start, it's a free program offered by Hollister. They get this huge silver box. It has a scissors. It has a travel pack. It has a bunch of supplies in them, for them to try and experiment with, and it's just that opportunity that they get. And we don't want them to miss out on it. Lastly, this is the new order form. I will have a cheat sheet available to you with the basic, with the average sizes in it that you can use, but it's pretty intuitive to follow when you read through. But anything out of the ordinary, you will need me to give codings and things like that, read the book and look things up. But this is the cheat sheet because they all need a prescription, right? When they go home for supplies. If they're going to a facility, you have to check with the facility. Some of the facilities do want to have this, but they want to be able to do it with their insurance. They don't want us sending it off because apparently it causes problems. So anyway, so that's that. All right, so moving right along, we have our friend here. This is a little stoner. And girls, if you've got any questions as we move through this, feel free, or any other questions you've got. So you want to have a nice clean slate when you're working with a stoma. So you probably would have already removed this. If you have a look at that little brochure, I can leave that on the floor here. You never want to use soaps. You never want to use foam cleanser when you're actually cleaning around the ostomy, because what it does, it leaves a residue. And coming to fitting an appliance, it's all about creating a good seal, like protecting the skin. Actually, that's called the peristoma skin, so you really want to protect that. So warm water, you can use an adhesive remover. I do use it often because people are quite in pain and things post-surgery, so I don't want it too much jarring and things like that, particularly if you've got to apply 3 or 4 a day, but just make sure that you get that adhesive remover off. So you want to fit, particularly when stool is liquid, and most of the time, even our colostomies, if people are having a colostomy, initially they'll have liquid stool. So that makes it hard because liquid wants to find an escape route, right? So when we do appliances, we really want to have a nice snug fit. So, you would work through, you might have a different type of sheet that you use. I know there's some see-through ones that are available as well, but you really want to find, so this 1 inch would be a good fit for this. They're not all this perfect round shape. Often they're little footballs, or sometimes they're actually quite swollen, and basically over a couple of months that swelling does come down, so they need to continually refit.
Is it okay to have any skin showing between the appliance and the stoma?
So that's a good question. Generally, if it is a solid stool and it's going to fall into the bag, not having it snug is not so detrimental, but I would recommend a nice, more of a snuggish fit when you've got the liquid stool, which is most of our ostomies, because you want to do everything you can to protect it, and if it goes over sutures and things like that, that's okay as well. So I've actually, if you look at that diagram down there, Bob, you'll actually see the process then again of the measuring and then going to cut out the actual, moving right along through it. And then I'm at the part here we've actually removed, this has now becomes your little pattern that you can use for next time. Sometimes I'll tape that, you'll see me, I'll tape it up on a little door or something like that if I'm in ICU. This is a wonderful resource that goes against the skin. It's actually very gentle, but this is where the new product comes into play. There's been a big shift away from paste in particular, and I would highly recommend, if you're going to use powder, know why you're using it and have a purpose to it. If you don't have a purpose or reason, just don't use it.
What is the powder for?
The powder, if there is breakdown in the skin, it can be a useful product, but I'm feeling with what I've seen, because so many seals are broken with overuse of powder, this may be a better solution for now, for most nurses. So this basically, I'll let you take that out and put some on the back of your hand, but it will dry actually like a second skin. And so you can actually take the little flange out. So if you want to pass that around.
So are these the same ones we use on our trach patients?
Same one for trach patients. Same, you can use it around a peg tube. Any type of erythema. You can also use it as a skin prep under tegaderms and things like that. So you want to have a nice clean palette. You basically want to clean all the way around, not clean, sorry, but put the barrier all the way around. And then the key is to let it dry for 30 seconds. I've had to use a little washcloth sometimes just to hold it over here, because it might be stooling at the same time, just for it to dry. The second product that we have here, highly recommend to use this. This one's actually a slim size, but yours will be more of the normal sizes that come on the floor. You want to pass that around. These are called little putty rings. And these are a great product, again, if you've got that liquid stool bob.
Which I usually do.
And what?
I said which I usually do.
Right, you've got liquid stool happening. But basically what you do is you just stretch this out to the size of the stoma. And if you happen to have a large stoma, which sometimes happens, you can actually use two and then reconnect them up. So you want to just stretch it out and just get that nice snug little fit around it, and just, I like to just gently go around it and press down, and then over the top of that we can place the flange, and again just going around the clock like this is what I call it, to try and get that nice seal. And then the second part to it is removing the little wings. We've got wings. Take the little wings off and around. Again, keeping it simple is the best. Using these extra products, these putty rings and that type of thing, are extra and optional. And it's more to do with prevention and protecting the patient and just creating that nice seal. And then finally, I get the patient to place their hand or something warm over it just to help to activate the glue and get a nice seal to it. Just take note of this little picture over here on the drawing. This is something I actually see quite often at Memorial. I'll get people saying to me, hey, the seal keeps on breaking. I don't know why. And it's because maybe the patient has an imbalance in their electrolytes, or there's something not quite right there and it's just pouring out. And unfortunately, it is what it is. It has to be emptied within half an hour to an hour, every half hour to an hour. And if not, it's actually the weight or the gas within the bag and that pull that actually breaks the seal. It's got nothing. You've actually had a good appliance on there. It's actually been that aspect to it.
Olivia, when we get a patient from surgery, a lot of times they don't stool while they're here until they go. And how long does it take for them to start having a stool in the bag? Yeah.
Okay, that's a good question too. Normally with the colostomy, when it's that lower bowel, you know, they're doing a reversal or that type of thing, it can take up to sometimes 7 days for you to get and normally you'll get the gas first. And they'll get a lot of that, you know, they'll get a lot of that irritation in their gut, and they'll be burping a lot because it's not actually, the bowel's sort of asleep and it's not actually coming through. And the ileostomy can be pretty quick, sometimes when they arrive back, or within, you know, when it's right up in the top end of the bowel. It can be, you know, within 24, 48 hours that starts to get active.
Do you want to see every new stoma?
I would, if possible. It doesn't mean that I'm always going to be there, but if you have a new, I would like to see them. And I will work with you. If you've already done a lot of the education, I'll back off. Otherwise, I'll step in and just supplement what's needed or actually run some of it. So I'll just work with whatever's being done. So I'm not offended either way. You know, I'll just work in.
So what things would you say to look for something for a healthy stoma versus an unhealthy stoma?
Okay, that's a good question too. So there's two things that we look at in ostomy care. We actually look at the actual stoma itself, and then we also look at the landscape. So we want to see a nice pink reddish colour is always good, and it can take a few days. Recently I had a very dusky one. I like to call it dusky. It's sort of that iridescent, almost a little bit see-through. It's not optimal, but it does happen. And then once that bowel gets working, it'll pink back up again. You never want to see something black or dark. It means that bowel is not getting the oxygen through it. So it's something that's why the bags are see-through here. While they're in hospital, they go more opaque when they go home. So that you can actually see the stoma. So,
Olivia, when would you be needing to use the stoma ring rather than just using the thing that comes in the packet?
okay, you can just use you can give it a go just with the plain flange. But I would, if you find there's leakage or you really think it's going to leak because there's just this high quantity coming out, I would just jump straight to the ring.
Okay.
So if in doubt, put the ring on. But most people function at home just with the flange. They don't use powder, they don't use paste, and they manage to get a nice stick. At home, they shower with them on and they shower also with them off. So when they're at home.
So the 1-piece, 2-piece, is that more just a preference? Is there...
It is. Eventually, sometimes you can get a better fit if the actual stoma is retracted in and the landscape is a bit bumpy.
Okay.
This one is sometimes a little bit better. It can sort of contour a little bit better.
Now,
That's not always the case though. Sometimes the 2-piece just...
we talked about warming it up after we put it on. Would warming it up beforehand, like right before you put it on, help at all? Like if I was a nurse and I said I wanted to just hold it for a little while to
Like
warm...
the flange or the skin?
The flange.
Yeah, you could.
To
You could
kind of help
actually
mold
do
it,
that.
especially to those
You
ones that
could.
are bumpy and...
Yeah, or the patient could hold it.
Right.
And remember, the patient can always get one of these in the first few days and just practice putting the clip on and off, burping it, that type of thing, or just getting used to holding it and not seeing that it's something that is, you know, there's a stigma sometimes attached to it. So emotionally getting them used to it and holding it and touching it.
Olivia, how do you use those drops? Those drops that are in
Okay,
there?
so we have these particular drops here. They're a great deodorant, and there's many types of deodorants that are out there. There's actually natural ones too that you can Google and look into on YouTube. But I normally put a couple of squirts in there. You would basically, with the 2-piece, you could actually, before you actually apply it, put it in here, or 12 drops. And the same in here. If you're emptying it, you've cleaned it out, you can just add 12 drops into there.
So is that okay if that touches the stoma?
It is, it's safe, but generally you don't want it to.
But
Yeah.
if it did, you
It's
know.
okay, I would just get a warm washcloth and just wash it off. So, yeah. All right, well, thank you.